HIV infection and AIDS. Acquired immune deficiency syndrome is a late stage of infection with the human immunodeficiency virus, and it can affect both the adults and children, often predisposing them to opportunistic infections and certain malignancies. A co-infection with tuberculosis and hepatitis B are particularly frequent in HIV-infected individuals and must be screened for in all cases. The main risk factors for HIV/AIDS remain transmission by exchange of body fluids and blood products through sexual contact, transfusion, needle stick injury, non-sterile surgical practices, and mother-to-child transfer. HIV infection is currently not curable. However, for persons living with HIV infection, as PL-HIV, effective antiretroviral therapy as ART is available countrywide at accredited centers at the regional and district level in both public and private health facilities to which all diagnosed patients must be referred. The prevention of infection remains the key to reducing its spread, cause human immunodeficiency virus. Symptoms: persistent cough, persistent or recurrent diarrhea, weight loss, skin rash, persistent or recurrent fever, and mouth ulcers. And the signs are weight loss, chronic diarrhea, prolonged fever, generalized lymphadenopathy, oropharyngeal candidiasis, persistent cough, generalized dermatitis, recurrent herpes zoster, as in adults, chronic progressive and disseminated herpes simplex infections in adults, and fingernail changes, for example, blue discoloration of the nails, as in adults, also failure to thrive or slow growth, infants and children, and recurrent common infections, for example, otitis media, laryngitis, as in infants and children. So investigations, confirmatory HIV test as HIV-1, 2, HIV-1 and 2. Also viral load as HIV viral load, CD4 count, and other tests as required. So other baseline tests for HIV, hematological test as full blood count, biochemical test as blood urea, electrolytes and creatinine, liver function test, fasting blood sugar, cholesterol and lipid profile, routine examinations like urinalysis, urine RE, and stool RE. Those were respiratory examinations like TB screening, chest X-ray, and serological tests. The serological tests, HB, as hepatitis B surface antigen, and supplemental tests. So these tests are performed depending on signs and symptoms. So histology on skin and lymph node biopsy, and kidney biopsy, screening for STIs, pregnancy test, so pap smear, HPV, DNA. The main treatment objectives are to suppress HIV replication as low as possible and for as long as possible, and to preserve and enhance the immune function, CD4 restoration, to improve quality of life, to reduce morbidity and mortality related to HIV, and to promote growth and neurological development in children. The pharmacological treatment, standard treatment. So for first line treatment, the preferred regimen, give tenofovir plus lamivudine plus efavirenz. You can give tenofovir plus entericitabine plus efavirenz. And caution. So caution with tenofovir in renal dysfunction. So with that, you can give a different regimen. And the comment is monitor renal function, including urinalysis, when you are giving this regimen. The alternative regimen, tenofovir plus lamivudine or entericitabine, plus nevirapine. So caution with tenofovir and renal dysfunction, and nevirapine is contraindicated in liver dysfunction and NVP, so nevirapine hypersensitivity. So you monitor renal function, including urinalysis, and you stop nevirapine if client develops jaundice or severe rashes, and then you refer to ART Center for further management. Also, you can give zidovudine plus lamivudine plus nevirapine. Zidovudine is contraindicated in severe anemia, and nevirapine is contraindicated in liver dysfunction and nevirapine hypersensitivity. Tenofovir is to be used where HB is less than 8 grams per deciliter or drops more than 25% from the baseline value in a client on zidovudine as AZT. And stop nevirapine if client develops jaundice or severe rashes and refer to ART Center for further management. Or still on the first line treatment, you can give zidovudine plus lamivudine plus efavirenz. Well, zidovudine is contraindicated in severe anemia. Tenofovir is to be used where HB is less than 8 grams per deciliter or drops more than 25% from the baseline value in a client on AZT. That's zidovudine. For second line treatment, the first alternative, the medicine you give zidovudine plus lamivudine or entericitabine plus lopinavir or atazanavir. So if tenofovir based first line, or you give this regimen if lopinavir was used for HIV-2 in first line, and for this you use atazanavir. So for the second alternative, you give tenofovir lamivudine plus lamivudine or entericitabine plus lopinavir or atazanavir. So if you do this, you give this if zidovudine based first line, or you consider abacavir if patient has used both tenofovir and zidovudine. Special considerations. So for HIV co-infection with hepatitis B, the recommended regimen shall be lamivudine plus tenofovir plus efavirenz. Lamivudine and tenofovir are active against both hepatitis B and HIV. Dual HIV and HIV-1 and HIV-2 or HIV-2 infections due to the ineffectiveness of non-nucleoside drugs as nevirapine and efavirenz in HIV-2 infection combination of nucleosides and protease inhibitors. So nucleotides and protease inhibitors should be used rather. So protease inhibitors such as lopinavir and atazanavir or ritonavir should be rather used. The referral criteria: refer all HIV positive patients to an accredited treatment center.